Hello guys, my name is Eva Washiraki Konyo. First of all is to say that I'm grateful for all the support that you've shown me in all my programs. This time, we decided to look into the issue of mental health. To help us understand more, we talked to Dr. Susan Njuguna, who gave us her insights about the issue. Karibuni sana. Hi, what's your name and what's your profession?
My name is Susan Njuguna. I'm a medical doctor by profession.
So what do you understand by mental health?
Maybe I might not give the global understanding, but I can give my understanding. Yes. I think mental health is one state of mind, especially the ability to cope with the ordinary day-to-day challenges in a healthy manner that will enable them to be the best version of themselves, basically, yeah.
As a doctor, probably, would you like maybe to tell us if you've ever gone through any mental health issue and how you overcame it?
Okay. So one of the things about profession as doctors is we go through very strenuous things in terms of even like our bodies are pushed to the limits, our minds also pushed to the limits. One of the things that I remember dealing with is as a child growing up, we were always high achievers. We always had to reach this sort of mark of excellence. So growing up, we actually end up having this high performance anxiety where like you're not even patient with yourself even when you don't perform as well or things don't really go your way. And it's especially hard when you lose a patient. So like one of the things that I face is that high performance anxiety where I feel like I always have to achieve, being the best of my game. And in this era of social media and everything, you always feel like you're falling behind. Another thing is like, for example, when you lose a patient, most of us don't have that very good psychosocial support. So we sort of like become detached. That's why you see like most medics, actually after some time, they don't even know how to process even death. That's why you see most doctors are even so blunt when it comes to people passing away. So yeah, depression and I think high performance anxiety. Yes.
Like recently, we had a case of a doctor from the Kenyatta National Hospital who committed suicide. Could that have been the anxiety or the depression case maybe?
You see, the funniest thing is everyone sees the doctor, but people forget to see that they're human beings as well. So even underneath all the titles and everything, there's always that everyone is just fighting a constant battle. And the worst thing about it is we are in a society where mental health is frowned upon. Even among health workers, I'll tell you for a fact that even as a doctor, you face a lot of stigma if you come out and say that you're actually struggling with a mental health issue. So there is not enough support. So probably had she had the right channels, maybe had she felt like she was not the only one going through it and had a support group, maybe that would have been a different issue. But again, I'm not in her shoes, so I cannot really comment on that because I don't know what exactly she experienced. But I do understand that sense of helplessness where it reaches a point where you feel like the only thing that you want to do is end your life. In fact, I read a quote recently that said, people who commit suicide don't actually want to die. They just want their life to change from what it is at that point. They don't really want to die. They just want a change. And they're just tired of their life where it is at that point. Yeah.
So what are some of the recommendations maybe you would give for people who are probably going through these mental health issues?
Number one is one of the things that I've learned in my own journey is part of our emotional traumas and mental health issues actually stem from our own families, knowingly or unknowingly. We were all born into our different families and they molded us to be who we are. But unfortunately, some of our parents have not dealt with their emotional traumas. And if they are not aware of those cycles, they end up passing it to their children. So the thing about it is now understanding where you are as a person. Just learning to be more patient with yourself in this journey. Another thing is social media. Actually, social media has been linked to depression and in high levels of anxiety where you constantly feel like you're not achieving as much as the next person. So maybe one of the things is just to be realistic with your goals. Where are you right now? Where do you want to be? Then the beauty about it is there's so many support groups out there. There's so many people dealing with mental health issues. So it's about time we started having the hard conversations. It's about time we started really talking about mental health to the point that it's not stigma anymore. Just the same way, like in the 80s, when the first case of HIV and AIDS came out, and there was so much stigma. But right now, when you hear HIV and AIDS, it's actually not a big issue. So people need to be desensitized that mental health. Actually, I feel like there are so many connotations. Like mental health means that you're crazy. Doesn't mean that you're crazy. Also, dealing with a mental health issue does not mean that you're weak. It doesn't. I was actually reading somewhere that 5 out of 6 people with a mental health issue have not sought help for that. So that is actually scary, because that now will tell you the kind of people who have unhealthy coping mechanisms. So I think we need to have really serious conversations, and we just need to open up. People just need to be more honest about what they're dealing with. Yeah.
Being a medic, we know that the First Lady opened a mental health institution at Chiromo. Do you think that this institution is going to bring a positive impact to people who are going through mental health issues?
Well, let me be honest. I know her intentions are good, and it's a beautiful thing opening a health center like that. But to be honest, a center in Chiromo, what percentage of the population will actually have access to that? Currently, right now, they are in the counties, they are county referral hospitals, they are level 4s and level 5s. My thinking is, let's strengthen those systems. You don't need newer systems. The systems are already there. If you just go to a public hospital psychiatric ward, it's one of the most depressing places to be, because you see people with mental health are being treated almost like prisoners. There's no psychosocial support. People are not even aware of their conditions, and there's so much stigma. So my thinking is, let's start from the ground. Let's start from the basics. The systems are already there. We don't need more buildings. We don't need more systems. Let's strengthen them from the ground up. Currently, right now, in our county referral hospital, we have a psychiatric ward, but we only have one psychiatrist. So imagine one psychiatrist catering for Nyeri. Yes, so you can imagine that that's actually overwhelming even for him, even as much as he wants to help people. But how about we increase capacity training? Let's get more psychologists there. Let's get community health workers to disseminate information that, yes, depression is there, anxiety is there. It doesn't mean that there's anything wrong with you, and there's a way out of it. Look at even the drug and the drug abuse that is there. Look at what is happening. Even with coronavirus, a lot of people have lost their jobs. A lot of people have lost their livelihoods. And for a lot of families and a lot of people, they've lost their sense of identity. So instead of, now you see, fine, yes, the center has been opened in Chiromo, but what does that mean for the common wananchi? What does that mean for people on the ground? What does it change for them? Exactly. So my thinking is, it's a good initiative. I know she means well, but let's strengthen the systems on the ground. Yeah.
Thank you so much. What would you tell those people probably who are thinking of, maybe speaking of drug abuse, yeah? So what would you like to tell those people who probably seeking to maybe to seek help from rehabilitation centers?
The number one thing is, as an addict or as someone who's dealing with a mental health issue, you need to ask yourself a very important question. Are you tired of living the same way, and do you want to make a change? So does the person who you really want to be is going to cost you a lot, but you have to choose that person despite everything. So sometimes, yes, you will be challenged. Yes, you will listen to a lot of people, but you have to be real with yourself. Do you want to continue with the same cycle for the next 10 years and then pick yourself up? And right now you have an opportunity to change and to get the best version of yourself. The other thing is, be patient with your journey. A lot of people are struggling with depression. A lot of people are struggling with anxiety, and people think that after one session, everything is going to be okay. No, it doesn't work like that. With mental health, you're constantly battling, and you're constantly learning and unlearning. And even if you unlearn, you will stumble a bit. But the thing is, you just need to choose progression over perfection. You just need to keep moving forward. So that's what I just tell everyone, that you have to choose yourself.
Oh, thank you so much. Very great information we have there. So our viewers, we have it from a medic here, and Susan has already told us how exactly we should deal with our mental health issues. So I thank you so much for your time. That's very, very informative, and I hope it's going to reach out to as many people as possible out there who are probably going through all these issues. We have come to the end of the show. As you have heard, mental health related issues are issues that can be solved if only we choose ourselves over each and every problem that we go through in life, and also seek as much help as possible. Kindly make sure that you watch and subscribe to my YouTube channel for more shows. See you on the next one.